Hi, I'm Chang He with Telos Functional and Integrative Medicine. Thank you for stopping by. In this brief video, I'm going to introduce you to the treatment model that we employ here at our clinic. In this first image, you can appreciate 4 colorful columns. To the rightmost is symptoms. And though it's not an exhaustive list, these are not unusual as part of the list of concerns that our clients come to us with. On the far left is, again, a non-exhaustive list of underlying causes. General principles in functional medicine guide us here insofar as underlying causes may produce different symptoms and signs. We need to be mindful of the complexity of the system and how we approach it. The middle 2 columns represent on the far left the leftmost of the middle 2 describes physiological damages, things that impact our physiology. Inflammation, catabolic physiology, insulin resistance, and oxidative stress are in many ways synonymous, but have very specific topics and elements that go with it. We don't lump it all together, but these have very common predisposing causes and, in many ways, very similar remedies. This column under body systems, which includes neuroendocrine, GI, and liver, are where we focus our work. In our test, not guess approach, this is the column that we focus on. The body systems in our approach reflects 3 components, the first of which is neuroendocrine, which is your nerves and your hormones. Perhaps oversimplified, it's your signal processing system. And the middle component is your GI system, your gastrointestinal system, no longer just a food tube that is for digestion and absorption and creation of waste. It is really quite an impressive world unto itself. Last but not least is your detoxification system, which sometimes is perhaps underrepresented in this term. Yet nevertheless, it is an important aspect when we think about how all these 3 systems work together. When we investigate your neuroendocrine system, oftentimes it's a saliva test, which then gives us a real-time assessment of your cortisol functioning. And for those of you who are familiar, these tiles are in many ways just neatly composed so we can organize any given system, but they're all entangled, as it were. In here, we can investigate male and female hormones. We assess dopamine, epinephrine, and in many ways together with your GI system, your serotonin function, and so forth. When we move on to a discussion of your GI system and the tests that we collect there, we look at potential pathogenic burden, so organisms that are clearly providing extra taxation on your immune system from a toxin production standpoint. For those of you who are familiar with leaky gut, it's a hyperpermeable condition that thwarts a lot of our immunologic and nutritional homeodynamics, as it were. We assess the impact of food, and then perhaps, in my view, quite impressively, we can get a very good cross-section of your microbiologic community. Last but not least, in this third system, we assess, of course, your detoxification system. We look at specifically the oxidative stress, which in our simplified terms is the quality of exhaust and how much of that exhaust is in your system, which can hamper a great many genetic processes, not limited to methylation, which is effectively how genes are turned on and off. Inflammation is a term that many of you are familiar with. This is something that effectively we can ascertain and discern when we look at the whole of these 3 tests, but it's just neatly cataloged here under the detox system. And perhaps last but not least, the value of nutrients as it reflects your food choices, your ability to digest this food, how your microbiological community then transforms this food for your use is vital to us. So in our approach, we use this 3-point system, or this triad, as it were, of tests to gain significant and powerful information and working with you to customize and personalize your care plan. If you're interested, we have additional videos that will describe particular tests and specific tests that we employ in any of these systems. Again, in our clinic, our first step is usually to collect test specimens from each of these systems, and together with your history and your presentation, craft something unique, personalized, and powerful for you. Thank you for stopping by. This is Chang here with Telos Functional and Integrative Medicine. We hope to see you soon.